So I'd like to introduce to you the HEE London Postdoctoral Bridging Scheme, which is a scheme run by London South Bank University in collaboration with King's College London and NHS Health Education England, the London region. A number of people that I need to introduce you to start off. So as I said, the overall scheme lead is the London South Bank University, and Dr. Adele Stewart-Lord, who's the Director of Research and Enterprise in the Institute of Health and Social Care, is the overall lead for this scheme and two other schemes that we run, which are the internship and the pre-doctoral bridging scheme, which some of you may have heard about. The internship has just closed. And I very much hope some of your staff have applied for that. The pre-doctoral bridging scheme is currently open with a closure date of next Friday. So do encourage staff to apply for that. And if you have any questions about it, please do get in touch. As all of our schemes are run in collaboration with King's College London, we also have a lead from there, and that is Professor Louise Rose from the Faculty of Nursing, Midwifery and Palliative Care. And King's takes specific responsibility for leading on the pre-doctoral bridging scheme. And finally, the focus on today's scheme, which is the postdoctoral bridging scheme. And London South Bank University takes specific responsibility for leading the postdoctoral bridging scheme. And the two people involved in that are myself and my role. I have a joint appointment as a Professor of Critical Care Nursing here at London South Bank University, which is a seconded post, but my substantive role is as a Director of Nursing at Guy's and St Thomas's Hospital with specific responsibility for nurse and midwife-led research. And my colleague, Professor Ben Thomas, who you can see and you'll hear from shortly, who is also a part-time professor in the Institute of Health and Social Care, and he's a professor of mental health and learning disabilities. So they are the key people involved in this scheme. Before we go on and talk more about the actual scheme itself, its objectives and what it involves, it's really important for us to consider the background and context of this scheme, which is the funding of which is provided by Health Education England under the leadership of Professor David Sines and Anna McGuinness. And I'd like to hand over to Anna today, who's going to talk to you a little bit about the background and context from an HEE perspective. So can I hand over to you, Anna, please?
Thanks, Suzanne, and welcome everybody. I was asked today if I could just go through why we set this up and where the context and the background came from. And it was really from conversations that we started having within the region in 2016, 2017, talking to our medical schools, talking to our universities, to have that conversation around how do we support and engage? How do we develop an offer for academic leadership in the region that will support advanced clinical practice and leadership within the region itself? We were also having conversations with NHIR at the time to say, what can we do within London? How can we connect up? How can we support people to access schemes that will allow them and give them the opportunity to develop their ability to apply for clinical fellowships and to undertake research and really advance practice and the evidence base for practice? And we were also having conversations with directors of nursing in the region to talk to them about the process and the development pathway for clinical leadership that would allow staff to develop evidence-based practice in care. So we were having all those conversations, pulling them together, and we actually thought as a region, how can we not do something that supports this? How do we actually take a step back and not? We need to be able to support the development of a pathway that will allow us to have a significant contribution to evidence-based practice and that will improve the clinical experience for our patients. We need to make sure that that patient experience is improved, And we need to think as well about how the transfer of knowledge works and how we share learning between our universities and our clinical placements, so that we can have those joint appointments start to form with regards to how do we instill a research culture in our practice areas, and how do we transfer that knowledge, and how do we support our universities to have that research come back in and be spoken about within the university context as being real and live, and not something that you do and then you put on a shelf. It's actually something that is a continuous journey. So at the time we went out and we undertook a pilot program. So we tendered for the delivery of a postdoctoral pilot program. So you've done your PhD. What does it look like next? Where do you go, rather than just being left? How can we support you and support your career journey after that point, given what everyone in the region has been telling us they want? We had 5 or 6 universities apply to deliver that, and LSBU were awarded the pilot. So that first pilot was delivered in 2020 and ran through COVID with 12, I know, it was crazy, 12 participants in the program. And I was really privileged to be at their final event, if you like, where they were presenting back and reflecting on the journey that they'd had during the program, and the experience that they'd had, and the learning that they'd had, and the projects that they'd undertaken. And it gave me goosebumps at the time, because it was such a positive outcome for all the members that were on the program. They were so dedicated to what they did and so enthusiastic about what they did and what they had managed to achieve in the face of everything that COVID had thrown them as well. So that was fantastic. But at the same time as that pilot was running, HEE on a national scale had come up with and was asking every region to develop a suite of offers. So we would have an internship for those who were considering doing their masters or what they wanted to do. We would have a pre-doctoral for those who had done their masters and were looking to move to doctoral research, and a postdoctoral program as well. So we're here to talk about the postdoctoral program. And because we'd ran the program and we'd ran the pilot in London, we were very privileged to be able to have the evaluation from that learning that LSBU had undertaken with that pilot, to allow it to feed into the offer that is now being made available. So very much the learning from that pilot has influenced what the program currently looks like that is on offer in the region. So we had the first program was offered last year and started in February 22, and now this is the next year of that program. We've got funding for 3 years, so it will be running again next year. Does that answer everything, Suzanne? Can I hand back to you?
Yes, of course. That's great. Thank you so much, Anna. Sorry, So I'm going to actually hand over to my colleague Ben now, who's going to take you through the scheme itself and give you a little bit more detail about the scheme. So over to you, Ben. You're on mute, Ben.
There we go. Hello, everyone, and nice to see everyone here this afternoon. As Suzanne said, I'm Ben Thomas, and I'm a professor in the health and social care with faculty with Suzanne, and jointly we run this program. So the scheme objectives, here's a list of what we're hoping you will achieve and what we hope you want to achieve by the end of the course. I won't read them out, but you can see here that it's important that you have the necessary experience to apply for further formal research training, that you're able to demonstrate insight into the clinical academic career structures. And then I think one of the things that the course provides is trying to get people to network so that they can continue on that clinical career structure. I think it was Anna who said in the beginning that the course is all about helping people become clinical academic careers. And I was one of those people, unfortunately, that did a PhD, and having finished it, didn't quite know what to do with it. But eventually, after doing various jobs, were able to find my way back into academia, and now doing lots of research. So this scheme is particularly there to help people develop and carve out a clinical academic career. Okay, Suzanne? Okay, so very briefly, the scheme overview. There are 10 places available for people to apply for. And what's required is that you actually do 225 study hours. So that's the equivalent to 30 days. And it's very important that that is agreed, you know, when your trust signs up for you to do this course. Every trust will get an award of £5,000, and that's paid into their continuing professional development budget, and it's up to the trust really how they spend that. The way it's structured, we have 5 half-day online masterclasses, and they're spread out throughout the year. The dates haven't been finalized, but they will be during these months that are outlined on the program. So that's February, April, June, August, and October. And then, as Anna mentioned earlier on, finally, there's a face-to-face event at LSBU in December, and that's when you will all have the opportunity to present the work that you've been doing all year. Okay, next one. So this slide gives you more detail of the outline of the scheme. And again, I'm not going to read it out, but as you can see, there are three main components to the scheme. The first one is the taught content. And as I mentioned earlier, we do half-day masterclasses and a series of debates. The second one is shadowing and teaching and research opportunities. And the scheme enables you and provides opportunities for you to really become involved in academic life. And so whichever organization you're affiliated to, whether it's LSBU in this case, or any other organization, you will be able to gain teaching experience at undergraduate and postgraduate level, PhD supervision, which is great for people to be involved in. And then the third component is executive coaching. So it's important that you identify a coach from within your clinical area, but also you'll be allocated an academic coach. And then the idea is that you have monthly meetings with academic and clinical mentors. You'll be helped to develop an action plan, and you will also be developing a reflective e-portfolio, which details the experiences and the learning that you've had. And then you've also will belong to a peer action learning set, which will provide you with peer support, and which most participants who undergo the scheme find really helpful. Okay, Suzanne, thanks. So the expected outcomes of the course, again, there are 3 of these. The first is an academic report, and that will form the basis of your oral presentation come next December, which outlines the progress that you've made, and also your preparation of your postdoctoral application. As I mentioned, you'll also produce an e-portfolio of evidence to support your agreed learning objectives and scheme outcomes. And then finally, an outline of an individually tailored development program to support a postdoctoral fellowship application. So, so we are expecting some outcomes, and it's very important that these are carried out, but people enjoy doing them, and it really helps with their thinking about their careers and where they want to be in the future. Okay. There we go. I'd like to hand over now to Dr. Matthew Alders, who's one of our participants this year. And Matt is going to talk about his experiences of the course. Thanks, Matt.
Thanks, Ben. So as Ben mentioned, I'm on the course this year. I thought I was going to briefly talk to you about where I was at in terms of my career before I applied for the course, my experiences during the course this year, and then what I'm hoping to be able to work towards when I've finished. Just to help if you're considering applying for the bridging scheme, how it might help you and why it's a great opportunity to engage with. So as the slide mentions, I'm a senior staff nurse at GSTT. I worked there before I started my PhD. I did my PhD full-time at King's College London, finished in 2019, and then went straight back to my clinical role as soon as I finished my PhD, and immediately felt quite lost about what I should be doing next and how I should be continuing to trying to engage in academic activity. For example, looking at working on publications from my PhD work, or looking at further postdoctoral funding opportunities or training programs. A full-time clinical role, as I'm sure lots of you are aware, is all-consuming. So it's really difficult to think about applications and where to look for further opportunities whilst doing your full-time clinical role. So the bridging scheme for me represented an opportunity to take some time out each month to have some structure around thinking about where I was at in my career, what my strengths and weaknesses were, and what sort of development opportunities I should be looking to apply for. So during the course of the bridging scheme so far this year, it's been a really positive experience. There has been a really encouraging community, I guess, that we've developed between the other participants this year, who we're all at various different stages in our careers, but there is a lot of overlap between the challenges that we're facing or the opportunities that we're looking to find. So it's really helped me develop a network within my organization, but also external to my organization across London. As Ben mentioned, some of the peer learning sets that we are that we facilitate with each other is helpful for identifying specific problems that we have where we're at in our career, whether that's having conversations with someone in our organization about freeing up time to engage in more academic work, or whether it's about a conversation in terms of salary or pay. It's really helpful to hear other people's experiences with these things, which are really relevant to where I was at. And then the structure of the program has meant that it's been really helpful at various points over the course of the year to think about training different skill sets and different opportunities for thinking about what I want to be doing next. And then as we're coming towards the end of the course, as Ben mentioned, we're looking at producing the outputs from the bridging scheme. So thinking about consolidating a record of all of the work that we've done so far. So attending the masterclasses, the peer action learning sets, the debates that we've taken part in, and all the various different kind of teaching opportunities that we've had, consolidating that into a document and then sharing that with the other people in the bridging scheme. And then for me going forwards at the end of the scheme, it's really helpful to for me to identify where I'm at now, what I can do to make myself a better candidate to apply for these postdoctoral NIHR fellowships, be very aware of my strengths now and what I need to develop further, and have some confidence in I can actually have conversations with my managers and with my department around building more regular time within my clinical role to engage in more academic opportunities going forwards after the bridging scheme is finished. Thank you. I'm going back to Suzanne now. Wonderful. Thank you.
Thank you so much, Matt. And some people might have some questions for you later on, if you don't mind answering them about, because I'm sure they'd rather hear from you about the reality rather than us about what we think the reality is. So, okay. So just a couple of words about the application process, because we often have a lot of questions submitted to us about who can apply and how we determine eligibility. I mean, all of this information is in the application pack, so it should be fairly clear, but just to pick it out, anybody who is registered with one of the professional statutory regulatory bodies that is listed on the NIHR website is eligible to apply. So that includes obviously the Nursing and Midwifery Council, the HCPC, the Academy of Medical Sciences, the British Dental Council, and I can't remember the names of all the rest, but the Optical Council, and all sorts of therapies. So that link takes you to that list. So if you're not on that list, then you're not eligible to apply, is the first thing to say. The other really important thing is that what these schemes are trying to do is develop opportunities for clinicians to develop a clinical academic career. And so to be eligible for the scheme, you must be employed by an NHS provider of health or care services. And there's a little bit of debate around what that means, but actually you could have because a lot of joint appointments, for example, you have to have a substantive role with one organisation, and like me, a secondment into another organisation. So if it's on a secondment basis and you're spending 50% of your time in an NHS organisation, that's absolutely fine. But for example, if you're fully employed by a university with an honorary contract to link to a hospital, that's not quite the same thing. So you must be working 50% of your time in an NHS provider organisation, either on a substantive contract or on a secondment contract. You also needed to obviously have completed a doctoral qualification, because this is a postdoctoral scheme, or be awarded by the end of January. So obviously that's a little bit tricky in the sense that if you're waiting for a viva, you won't necessarily know the outcome of that. But any offer that would be made would be subject to a final award by the 31st of January, so prior to the first masterclass. There is no time limit on when you got your doctoral qualification. There used to be, but we do recognise that people come from all different positions, and for many different reasons, people may not have progressed their career after their doctoral qualification. So there are absolutely no time frames, although I think we do recognise that generally there is a preference. If people have done their doctoral qualification within the last 5 years, they tend to benefit more from the scheme, but that's a sort of desirable option. And obviously you need to be clearly motivated to want to develop a clinical academic career, to be both a clinical and research leader of the future. So you really do need to show that to us, and that you want to do that via application. We've put to the NIHR Advanced Clinical Academic Fellowship Award, but it doesn't exclusively have to be that. And we recognise that obviously that's a very competitive funding source. And there are other opportunities for postdoctoral fellowships offered by other organisations. So it isn't limited to the NIHR, but that is the sort of focus of this scheme in terms of the information. So hopefully that helps clarify some of that. Just some timelines and process things. So there is an application form, and that can be obtained through our research administrator, and you can see her email on here. And the application form and the supporting documentation needs to be submitted by midday on the 21st of October this year, and labelled as it says here. I won't read all of that out. Within the application form, we are expecting you to give us an outline of your project plan, and particularly thinking about what you want to do during the year in terms of developing your project. So we don't need to know all about your plans for your NIHR clinic, I was going to say clinical lectureship, that I don't exist anymore, the NIHR ACAF, what you're going to do there, but the sort of what you've done today, how you're going to build on it, and where the LSBU bridging scheme is going to fit into that, what you're going to do that through that time to build up to your competitive application. Within the application form, you're also asked to highlight your suitability against the eligibility criteria. So please make sure you go through those and talk to them individually, so we are very clear that you do meet the eligibility criteria. And then and you're also required to identify an Nhs mentor. So that should be someone within your organisation who has the appropriate knowledge, skills, time as well to support you, meet with you monthly, and to signpost you to opportunities within the trust, so that actually you can develop your clinical academic career from within the trust as well, because that's often one of the biggest barriers people face. So do think carefully about who that should be. We don't say that it has to be anybody from a particular professional group. However, again, think about, you do want somebody who understands the challenges of healthcare professionals outside of medicine trying to develop a clinical academic career. So really important to think about your mentor from that point of view. And finally, 2 additional documents that you will need: an up-to-date CV, maximum 4 pages, please. We don't need to know your detailed life history, and a letter of support from whoever is most appropriate from your profession. So all of those things need to be submitted as part of your application. And just the final slide here is just key timelines. So as I said, midday on Friday, the 21st of October for applications. Online interviews for shortlisted applicants will take place on the 25th of November. And then the first masterclass will take place on Friday, the 17th of February next year. All masterclasses are held at the same time, 12:30 to 4:30. But as Ben pointed out earlier, we're just reviewing the dates that we ran last year, just to make sure that we don't clash with any bank holidays or key other events that are going on before we finalise the rest of the dates. So hopefully that's given you an overview of the scheme and what you need to know. A really important person is Tina, and Tina is our research administrator. And as I said before, her email is on application forms, obviously there if you want further information, and mine and Ben's emails are there as well. So at that point, I'm going to stop sharing, and we can open up for Q&A. Thank you.
So there are no questions in the Q&A box so far, but just to let you all know that you can pop your questions in there. So pop them in, let us know who your question is for, or if it's just a general question, please pop it in there, and we will work our way through them.
I would also say, even if you haven't got a specific question for you personally, if you think there are queries that some of your colleagues might have, then do put those in the chat as well, because this is going to be recorded. And so actually, if you've got anything that you think other people might ask, please ask for them so that that information can go out to them. Gosh, I can't believe it was all that clear and nobody has any questions whatsoever. Either we've done exceptionally well, or you've joined this webinar in previous years, and obviously a lot of the information is the same. We haven't changed too much. Anna has her hand up, I think. So I don't know if she's got a question or.
I'm being well behaved, but someone's just put in the chat that their Q&A is disabled again.
So it's not. I've just double checked. It's not, because we started with some Q&A questions. So it's not disabled. But if you're unable to use the Q&A, please do pop them in the chat box instead, and we can pick them up there. That's fine. So Helena, if you do have a question, please pop it in the chat box and we can answer that for you.
While we're waiting, I think one of the questions, one of the anxieties that people often have, but often turn out. Oh, actually, I'll hold that because I see somebody has put a question in there. I can't entirely read it.
I can read that.
Yeah, please,
so
thanks.
Nikki says, I am wondering if it is challenging for applicants to persuade managers to release staff for 30 days. Have you had any comments about this before?
Well, I'm going to take that first, and then I'm going to let Matt perhaps comment as well from a clinical perspective. The answer, yes, it is challenging, and there's no point pretending it isn't, because we all know that we're working in a very challenging space. But it is a really important part of the scheme, and it's part of the reason that we run the scheme, so people have protected time to dedicate and have thinking time as well. So it's important not only to have the time to attend the masterclasses, but actually have time to think about what's important for you as an individual, to meet with your mentors and to do some of the activities. I think one of the things that's really helped other people over time is a conversation with their managers about how this can benefit the clinical environment, what it can do for the service, so that actually there's some benefit that goes back rather than them seeing it as being a given. And obviously there is the £5,000 that comes into the trust that can be then taken by the department and used in whatever way people want to. But we do recognise that £5,000, and even if you've got money for backfill, actually finding people to backfill and filling posts isn't an easy thing to do. So I don't have any clear answers about that, but I think a conversation with managers about the benefits, both to them, the service, and to you professionally, but also linking it, I would say, to the sort of national drive around developing clinical academic careers and engaging more NMAP staff in research is really helpful as well, so that they can see why they should prioritise this alongside all their other priorities. So I hope that partly answers your question. Matt, did you have anything you wanted to add to that?
I think I would just echo some of the points that you were saying, Suzanne. I think I had a conversation with my manager before I applied, because a lot of times managers won't necessarily have engaged in research themselves, so they might not understand what it involves and why this amount of time is necessary. So it's helpful, number one, to explain why it's important to take the time to engage in this bridging scheme, to engage in further work, and then bring it back to how it's going to benefit that department or that clinical area. Because overall, I think the intention is that we're all interested in developing a clinical academic career, and in the future that would mean not just 30 days of engaging in research activity, but hopefully more so. So I saw it as a stepping stone to develop more work. The difficult thing is that in research the benefits aren't immediately available, so it takes time to do the work. It takes time to write that up and then publish it and then share it and then put that into practice. So I think it's just not only talking to them about getting permission, but engaging them in the process, so they can understand that it's not going to be potentially immediately beneficial to their department, but in 6 months' time, in 1 year's time, this is what I want to bring or help. And also ask them questions around how they think things could be improved, or where their pressure is, or what their challenges are, so that you can align all those things together and not just about you being on the bridging scheme, but you bringing back things to their department or to their clinical area.
Thank you, Matt.
Sure. Right. Okay. We've got quite a few questions in the Q&A box and then one in the chat box. So let's just go straight in. So Mohammed says, what's the acceptance rate from previous years, especially for those who will submit their PhDs end of this year?
So I think the positive news is that at the moment, this tends to be a fairly low level of number of applications. So we always get over the number of applications for the places, but not by a huge amount. So this is one of the most likely success applications that you're going to do as a postdoctoral researcher, certainly compared to, you know, if you're thinking about applying to the NIHR and MRC, etc., etc. So that's the really positive news. Obviously, what we do when we get the applications in is that we really look at them carefully and we try and judge from the people that we have that are eligible, who will benefit the most. And actually, that benefit may come from lots of different perspectives. So it won't be the same for everybody. So we may see that for some people, applying directly post-PhD would be of huge benefit and we want to give them the opportunity. Whereas we might see for some others, based on what they've put or in their interview, that actually it might be better for them to wait a year or two and then apply. So we try and be as flexible as we can, rather than having really hard and fast rules about how we select our applicants. Ben, I don't know if you want to add to that, because you were involved in the selection process last year, weren't you?
Yeah, I was trying to think back, and I mean, the thing that struck me first of all was the high caliber of applications, I suppose, and how amazing some people had done, you know. And I did wonder why they were applying for the course, because it seemed to me they'd already developed a clinical academic career. So as Suzanne says, even though one or two of those did get on the course because they really wanted to, I think it was more beneficial to those people who were, you know, who just got their PhDs or had got them fairly recently, really. And then I think somehow the course helps them to gather momentum, I suppose. What I remember last year, we didn't turn that many people down, actually. We did. There were a few people we did turn down. There was one person particularly I remember who just wasn't ready. I don't think they even knew what the course was about, which is a bit of a shame, really, because a lot of the questions are geared towards that. And, you know, what do you hope to gain from the course? So that was a bit of a shame, really, that I don't know whether somebody just said, oh, why didn't you apply for this? But it was when we interviewed the person, that it was quite clear they didn't really know what they were letting themselves in for. And, you know, and we don't want anyone set up to fail, really. So I just think, if you think this is the course for you, or this is a scheme for you, I would apply, because it'll be a learning experience just going through the whole process, really. And yes, as Suzanne says, we're not there to make it difficult for people. We're there to really try and facilitate people's career in clinical academia. So, yeah.
And I suppose I'd just add to that, that obviously we have 10 places funded through HEE for this year and next year, but we don't know what's going to happen after that. Yeah. And actually what we would hope to see is that if we do get continued funding, I'm looking at Anna here, but if we do get continued funding, what we would hope to see is a gradual increase in the number of applications as we have more NMAPs obtaining doctoral level qualifications and then wanting to go on, particularly as the culture changes, we hope, around clinical academic careers in practice. So I would say now is the time.
Okay, two questions from Liz. If you're lucky enough to be shortlisted for an interview, is there any flexibility on interview dates?
What was the last bit, Neil? Sorry.
If you are lucky enough to be shortlisted for an interview, is there any flexibility on interview dates?
Are you all right with this, Susanna, or do you want me to?
So we have only one interview date scheduled, but again, Ben and I are keen to support people as much as we can. So if there was a very good reason why somebody couldn't attend on that particular date, we would be very willing to have a conversation with them to see if there was something we could do. Obviously, there is a timeline in terms of getting people onto the scheme and starting the scheme, but we would do as much as we can to help people through that.
Thank you. Is there an expectation that you have a fully worked up research proposal at the end of the year to start seeking opportunities to support this?
Ben, do you want to take it or shall I?
Yes, my response is not a fully worked up. I think that would be asking a lot actually of people. But what I mean, the main thing is to use this opportunity to really start planning your application, and having a clinical academic mentor and a mentor from the clinical area and exposure to all these other people and your peer group and everything. It's just such a wonderful opportunity to try and get your thinking clear about what it is you want to do. So it varies. Some people manage to find the time and are very, very clear about what they want to do, and get further than others, really. But I wouldn't say we want a fully worked up proposal.
No, I mean, it clearly says in the application that it's a draft we would be looking for. I think the other thing I would say is that often what people start off thinking they want to do at the start of the postdoctoral bridging scheme, the process of going through the scheme really helps them to think about that and to think about, is that the right path? Is this the right project? And so this is an opportunity for reflection as well, which is why by the end of the scheme, we want people to have a sort of an outline of what their plan is going to be next. And using a template like the NIHR application scheme is useful for that and enables you to put your sort of development program in or another template. But as Ben said, we're not expecting everybody to submit to the next round of the NIHR scheme. Some people think they're going to at the beginning, but halfway through they sort of think, oh no, actually, I need to do this, this and this first to really strengthen my application and make me more competitive. So, Anna, were you going to say something? I saw your microphone come off and on again. Did you want to come in there at all?
No, sorry, I just I hit it by accident.
That's okay.
Happens. Okay, another question for Suzanne or Ben. Does the 50% of time need to be patient facing? If you're working as a midwifery researcher, as an example, the time that you spend working could be used to support guideline development and audits.
I think you've answered your own question. Yes, that's fine. You have to be employed by the NHS provider, and we all know there's so many different roles within the NHS. And as long as you are employed by that provider organisation to support the delivery of patient care in some way, then that's absolutely fine. And we do have a number of people actually sometimes who are in research delivery roles or practice education type roles. And they're really important. And actually sometimes it's easier for those people to fit in this activity with the work that they're doing for the trust as well, and aligning it with the development of guidelines and QI projects and other stuff as well. So
thank you. Helena asked, I'm in the process of changing NHS trust. I would ask if my line manager would support me with the application and obtain a letter of support. Would that be sufficient? Does it have to be chief nurse? I also work part-time due to childcare. I will be happy to compromise using my time too. Would that be acceptable?
Anna, do you have a view on that at all?
So I think my only view would be it's got to be the organisation that you're moving to, because what you need is to have that buy-in from them. So when you say your line manager would support, I'm assuming that's your line manager in the organisation that you're moving to. but actually they need to have that conversation with the chief nurse and director of nursing as well, to say, I've got this member of staff coming in, are we prepared to support? Because you need that backing behind you in order to be able to have the conversation that says there are 30 study days, and the organization has got to be behind you to support you to have access to that. While you're happy to use, and I've had children as well, and Suzanne knows because she was lecturing me at the time, using some of your own time when you're not working towards your study is fantastic, but you've got little people in the house that need your time and attention as well. So you need to build that balance in to cover all of it. But I hope that answers.
I think just to add to that, in terms of the line manager, I would say it depends who your line manager is and how senior they are. So we're really looking for sign off from a senior member in the organisation. So whilst it might not be the chief nurse or director of therapies or whatever, it needs to be somebody at that sort of head of nursing or head of therapies type of level that has really got that oversight and can. That doesn't mean to say that people shouldn't be having conversations with their direct line managers as well, because they're the ones that are going to have to often facilitate the time. But we would be wanting to have that letter of support by somebody more senior within the organisation.
That is all for questions. None have come through, so I'll hand over to you for any closing, our panel for any closing last words. Thank you.
Does anybody have any closing last words they would like to add before I say anything, Ben?
Yeah, I just want to say, referring to that last question, really, I've been doing some work with the directors of nursing. They're not particularly called chief nurses of the mental health trusts. And I know there's fewer of them than but in order to gauge their support for the course, I suppose. And they more or less all assured me that if they had somebody within their organization who was eligible and wanted to do this course, they would do all they could to support them. So I don't know where your questions stem from, but don't be afraid to go and bang on that chief nurse's door and make your wishes known. It's your life, it's your career, and they should be facilitating that, not holding you back, really. And I'm sure Suzanne or I would happily have a conversation with them.
Yeah, I think that's a really important final point to make, that actually research engagement is in the portfolios of all of the chief nurses, chief midwives, chief therapists, whatever their titles are in whatever organisation. And actually, so it's in their interests to support this activity. And I think sometimes it can be quite nerve-wracking to go to them, but often just drop them an email. You'll be really surprised that they would welcome your email and respond to you. So yeah, just be brave and do it, is what I would say. But do talk to your line managers as well. Anna, is there anything finally that you would like to say?
No, I'd like to say thank you all for coming to the webinar to find out more about this, and I'd just like to wish you all the best. Whether you decide that this is something you want to apply for this year or next year or in the future, it's a fantastic program. It's a fantastic opportunity, and I want to wish you all the very best with your application.
Thank you, Anna. And Matt, is any final words from you?
Yeah, just that I did find it quite intimidating to consider contacting the chief nurse to apply for the bridging scheme, but now I can see that it's important, because it's about developing some sort of sustained research activity after you finish the scheme, and having a conversation with your chief nurse at the beginning is a beginning to having that sustained conversation about doing work afterwards. So I hope that when I finish the bridging scheme, I can continue to engage in research activity within my full-time clinical role. Thank you.
Thank you, Matt. So it just leaves me to say thank you to you all for coming. Please feel free to contact us if you would like any further information, or you've got individual circumstances that you'd like to talk about in more detail. Please share this recording with as many people as you can. We're really keen that as many people as possible get the opportunity to consider whether it's right for them. And do get your applications in before the Friday the 21st of October. And on that note, I'll just say thank you. Have a great weekend. And obviously the bank holiday Monday if you're not working. So thank you and goodbye.